Close to 2 million Kenyans who rely on antiretroviral drugs and septrin from public hospitals to suppress the HIV virus have been without the lifestyle-saving drugs for close to 7 months now. The most crucial drug, which is taken alongside the ARV, is cotrimoxazole, commonly known as septrin, has been out of stock, with patients directed to purchase the drug that was once free, something that has hindered their fight against other opportunistic diseases. Nuria Halake has lived with the virus for close to 20 years now and has traveled to Nairobi from Isiolo County for her ARVs refill, given that the only general hospital that supplies the drugs in her county has run out of stock.
At least hata kama ukiwa na dawa lazima uwe na kitu ya kukula ndio uweze kutumia ile dawa. Kama sasa unaona dawa pekee yake haiwezi kukusaidia.
We meet Halima Dayo at Shauri Moyo dispensary, where she has come for food donations from the Safaricom Foundation. She tells me that the main challenge facing people living with HIV is lack of proper nutrition, which is required during the uptake of the drugs.
Mtu ule immune yake bado iko chini. Magonjwa tegemezi kama kuhara, kukohoa, homa, pengine TB. Unaona? Hiyo inazuia. Na kwa sababu hakuna hospitali, sasa tukienda ku chemistry ni expensive. Na watu hawezi ka afford. Kama mtu anaweza ka afford Panadol, anawezaje afford septrin ya mwezi mzima ama ya 6 months.
Septrin is a drug used in antiretroviral therapy, but unlike the ARVs that disrupt the reproduction of the HIV virus, septrin is a combination of antibiotics that fights opportunistic infections.
Zamani tulikuwa tukienda hospitali tunapatiwa madawa, napatiwa ARVs zako, napatiwa septrin, napatiwa multivitamins. Daktari anakuangalia na kupatia hata tulikuwa tunapatiwa mpaka mafuta ya kujipaka.
The stock out of the drug is attributed to the reduction of funding from the United States President's Emergency Plan for AIDS Relief, as well as the Kenya Medical Supplies Agency COVID-19 corruption probe, which has halted medical supply activities. 3 weeks ago, Global Fund rejected Kenya's application to access 12.4 billion shillings to fight HIV, malaria and tuberculosis in the country, following a controversial decision to drop the Kenya Red Cross Society as the sole recipient of the funds. Kenya was allocated 42 billion shillings for the 2020-2021 period, where 70% of the funds will go to the Treasury and the remaining 30% to one or more selected non-governmental organization, who will then subgrant smaller NGOs in the country. If the deficient of the drugs continue to reign the country, then people living with HIV are set for a rough ride through their medication journey, even as the number of new infections and deaths from the disease are projected to spike in the coming years.
Mheshimiwa Mutahi Kagwe, tunaomba, tunalia, tulete septrin kwa hospitali. Magonjwa tegemezi ndio inatumaliza.
Jijina Magundu, K24 Evening Edition.